I hope all is good at your end and learning the muscles every day, stretching, strengthening, finding balance to your yoga practices. The next muscle, as we have discussed in the earlier classes, we have discussed about the abdominals, back of your shoulders, but the back muscle, the spinal muscle that we say, erector spinae. If you see the name of the muscle, erector spinae, so as the name indicates, erector, erect, spinae for spine, that keep your spine erect, that holds up upright. And these muscles are on the back of your spine. So the erector spinae, these are the three sets of muscle that we call iliocostalis, longissimus, and spinalis. So spinalis, that is close to the spine, iliocostalis, that from ilium and attaches to the costal, to your ribs. From ilium is the part of the hip bone that attaches to your costal, to the ribs, and longissimus on the outer part, the lateral place muscle. So guys, basically for you, in the basics, in the base, if I talk about, we don't have to focus on the individual muscles. So for us here, erector spinae, the back muscle, right? The back muscle, erector spinae, which keeps your spine erect, and the action of the muscle is spinal extension. Spinal extension. So this group has three sets of muscle running parallel to the vertebral column. So three sets of muscle that we have discussed: spinalis, iliocostalis, longissimus. Three sets of muscle that running parallel to the vertebral column. So contracting these muscles straighten the spine as in Tadasana, as the client asks to engage. If this is the posture, muscle is not properly engaged, as the client asks, like as the teacher say, contract, bring your shoulders back, and in the Tadasana, spine has to be straight. So you can feel the activation of each and every muscle fiber from here when the spine is straight. If it is drooping down, no contraction. But when your spine is straight into the Tadasana, you feel the lengthening of the muscle, means contraction on your erector spinae. Contracting one side or the other produces a rotational effect in twisting asanas. So when I'm going for any twisting posture, suppose like going this way, so contracting it on the one side produces a rotational effect on the other side. So one side stretches, one side contract here too. Contracting the laterally placed erector spinae muscle, this one, the laterally placed, which is away from the midline of the spine. So lateral one is away from the midline of the spine, produces lateral bending as in Utthita Trikonasana. When I'm going for the pose here, like in the Utthita Trikonasana, the triangle pose, so one side laterally placed, which is outer side, that contract in utmost. Forward bend such as Uttanasana and Kurmasana stretches this muscle. So as we have discussed that the stretching is always opposite to the action of the muscle. So when I'm going for the forward bending here, so muscle is getting lengthened, the stretches. So when they reach full length, they tilt the pelvis forward by pulling back on the back of the ilium. This is my back of the ilium, the hip bone. When I reach full length like here, so it gives a tilt and pull up, and this tilt stretches the hamstring muscle. So if you have a tight hamstring, no need to try to create pressure on your iliac crest. That's why we say bend your knees and lengthen your erector spinae first. So this tilt also stretches your hamstring muscle. Back bend such as Urdhva Dhanurasana, the bow pose, strengthen these muscles. So all the back bends strengthen your erector spinae. So guys, as we have discussed that forward bend stretches this muscle, back bend or standing poses strengthen these muscles. So this is the erector spinae, which keep your spine erect. Spinal extension is the action of the muscle. So from pelvis to the skull, skull to the pelvis, you can find three sets of parallel muscle along your spinal column or the vertebral column. So keep your spine strong, erect, right? As you get time, try to get it back, contract your erector spinae, and find a good foundation on your body. So muscle which we are going to talk about now, the erector spinae, right? As we have discussed in the PPT, in the PowerPoint presentation, guys, the erector spinae, the three main group of muscle, that is your spinalis, iliocostalis, and longissimus. So the three main group of muscle that covers your the erector spinae, that keeps your spine erect at the back part of your spine. So Shobit is with me once again here. So can you please turn around? Can you please bring your shirt out? So basically the muscle starting from the base, the spine from here, it is going up to the skull, the base of the skull. From here, the three group of muscles, right? The three group of muscles, that is outer way, inner way, and onto the middle. So these three group of muscle, that is spinal extensors we say. So if we say the muscle activation here, some muscle fibers are here that is attaches to the iliocostalis, from the ilium to the costal part, that is to your ribs, like this way. Some is more close to the spine and some is going to the, from the ilium to the base of skull. So guys, the function of this muscle, as we have discussed, that is extension of the spine. So if you extend your spine back, you feel this contraction on these, all the fibers. So other muscles are also attached here, like if you say latissimus dorsi is there, that is also for the extension of the shoulder, and just help about that here if there is no activation on your shoulder blades. So basically when you're going for the forward bending, muscle, so muscle stretches, it lengthens completely. Relax, come back. So can you turn on that side? Now bend forward, please. So see, this is the stretching, the complete stretching on your this part. So that's why we discuss if this is one part is going up, so maybe the middle fiber is more higher, so maybe stretch that more. So we need to equal lengthening of the erector spinae. Lay down on your belly. If you go through the posture like Urdhva Dhanurasana, the bow pose, so here you can feel the contraction of the muscle, the erector spinae. So in the forward bending, muscle stretches. In the backward bending, muscle engages. So this is the function of the erector spinae, relaxed. So as the name suggests, the name of the muscle which keep your spine erect, right? Which keep your spine erect. Come to the standing posture, please. So as you see on the back part, so when I'm going for the Tadasana, yes, this, so muscle is active. So this is erector spinae. So strengthen it, stretch it every day. So get rid of the lower back pain. Namaste, have a nice day.
عاشت بنتي عاشت بنتي عاشت بنتي، استمري. وطول ما حاطة عينك بعين ربنا وحاطة السعي الصحيح والذمة الصحيحة بشغلك، الله رح يرزقك من أوسع أبوابه. لا تحاتين، يتعبي على نفسك، ليش ما تتعبين على نفسك؟ في يوم من الأيام ممكن تفتحين مدرسة وتصيري مدرسة، توكلي على الله ورح تاخذك، يعني رح تاخذك، وهذا سعرك بالسوق ولا تنزلين عن سعرك، وأنا متأكدة إنه هي رح تاخذك.